Hello everyone, this is Dr. Eric Osansky, and during this presentation I am going to discuss how to manage your hyperthyroid symptoms while addressing the underlying cause of your condition. So let's go ahead and bring up the slides here. All right, so let's start out by talking about why should you manage your hyperthyroid symptoms. And obviously the reason is because there are risks of uncontrolled hyperthyroidism. Some of the risks include arrhythmias, atrial fibrillation, thyroid storm, decreased bone density. And if you want to learn more about these, you can visit my website. I have articles on all of these. And so these are really scary conditions, especially arrhythmias, atrial fibrillation, thyroid storm, but even decreased bone density isn't something to take lightly. So when you look at these risks, you might wonder, why not just get radioactive iodine or thyroid surgery? And there's a few reasons for this. So first reason is because these conventional treatment methods are not addressing, they're not doing anything for the cause of the condition. So for example, Graves' disease is an autoimmune condition that is affecting the thyroid gland. So a lot of people still think of Graves' disease as being a thyroid condition, but again, it's primarily an immune system condition. So if you receive radioactive iodine or thyroid surgery, yeah, without question, it's helping with the hyperthyroidism, but it's not doing anything to improve your immune system health. Well, how about another condition such as toxic multinodular goiter? So this isn't an autoimmune condition, although I've had a few people over the years who had toxic multinodular goiter and Graves, but typically most people don't have an autoimmune condition. But still, the radioactive iodine thyroid surgery, those are not doing anything to address the cause of why someone formed the toxic multinodular goiter. Reason number two is the second reason why you should not abruptly get radioactive iodine or thyroid surgery is because there are risks of these conventional treatment methods. And so with surgery, we'll talk about surgery first, because with any surgery, there's risks. And don't get me wrong, I realize that there's a time and place for thyroid surgery as well as other surgeries. So I'm definitely not anti-surgery. I'm just against people just jumping into the surgery without considering other options. And then there are risks with radioactive iodine. I mean, again, let's face it, this does involve radiation, and in other, not in the United States, but in other countries, they'll quarantine patients for a few days. In the United States, there are certain precautions, and like you can't, I believe you can't share utensils, no intimacy for a few days. You're not even supposed to, anyway, you could visit, do an online search for some of the precautions, but there are definitely precautions. And if you're a woman think about becoming pregnant, you have to wait a while before becoming pregnant. So there are risks. Now, I will say that some people receive radioactive iodine and they think it's the best thing they've done. In other words, if they had to do it all over again, they would do it again. But there's also people who have received radioactive iodine and regret their decision. And I receive emails every week from people like this who receive radioactive iodine and they don't feel well. And the problem is, you don't know what category you're going to fall into if you receive radioactive iodine. You might receive it and you might do great, and you might receive it and not do well. And either way, you probably need to be on thyroid hormone replacements. If you get a complete thyroidectomy, you definitely will need thyroid hormone replacements. And again, some people do fine with thyroid hormone. Other people, when they're on thyroid hormone replacement, they don't do well. And there's other issues people don't think about. So as of recording this video, there's been a shortage in some of the desiccated thyroid hormone brands. So not Armor, but WP Thyroid and Nature Thyroid, which are two of the better forms of thyroid hormone. So again, something you might not be thinking about now, but if someone's relying on the thyroid hormone replacement, that could be an issue. Of course, there are substitutes, but WP Thyroid is, as of now, at least the cleanest out there. Minimal fillers and no artificial ingredients. If you're taking synthetic thyroid hormone, it's not a big deal. But anyway, just things to keep in mind. And then reason number three, doing things to improve your health will prevent other conditions from developing. And so getting back to Graves' disease, again, this is an autoimmune condition, and the research clearly shows that someone who has one autoimmune condition is more likely to develop other autoimmune conditions in the future, such as rheumatoid arthritis or lupus or multiple sclerosis. So again, that's another risk. If you get radioactive iodine or thyroid surgery, and you don't do anything to improve your immune system health, you are at greater risk of developing other conditions. So if you do end up receiving radioactive iodine or you choose thyroid surgery, you still need to do things to improve your immune system health. All right, so let's talk about some of the conventional treatment methods for managing hyperthyroidism. So there's antithyroid medication, and in the United States, typically they'll recommend methimazole or tapazole. Sometimes they'll recommend propylthiouracil, which is also known as PTU. Definitely easier to pronounce PTU, just say PTU compared to propylthiouracil. So I'll be saying PTU. But PTU typically is not recommended because it's harsher on the liver. If someone's not doing well with methimazole, then yeah, they might be given PTU. Or if someone is pregnant in the first trimester of pregnancy, PTU is typically given because less risk of harm on the fetus when compared to methimazole. But then in the second and third trimester, they usually will be switched back to methimazole. And then there's carbimazole, which is, I usually see or commonly see with international patients, those who are overseas, and carbimazole converts into methimazole. And then there's beta blockers. So some of the more commonly prescribed beta blockers include propranolol or atenolol. And the main reason the beta blockers are prescribed is to help with the cardiac symptoms. So whereas antithyroid medication, that's lowering the thyroid hormone levels, the beta blockers are focused more on decreasing the elevated resting heart rate, helping with palpitations. If you happen to have elevated blood pressure, which not everybody with hyperthyroidism has. When I was dealing with Graves, I had an elevated resting heart rate, but my blood pressure was fine. Others have elevated blood pressure, but again, it depends on the person. Now, some beta blockers do affect the conversion of T4 to T3. They'll decrease that conversion, but they're usually not given for that purpose. And another thing to keep in mind, I'll talk about the risks of antithyroid meds in a minute, but one of the risks of beta blockers is that they can interfere with the production of coenzyme Q10, which plays an important role in mitochondrial health. So mitochondria, they are within our cells, most of our cells. And I've written some articles on mitochondria, or you could do a Google search of mitochondria and you'll find some interesting information. But if you take beta blockers, you might want to consider taking CoQ10, coenzyme Q10, which you could find in supplement form. Radioactive iodine treatment, I already mentioned, thyroidectomy. Of course, these aren't the same category of managing. When I'm talking about during this presentation, managing symptoms, I'm definitely not recommending radioactive iodine or thyroidectomy, but without question, they do manage hyperthyroid symptoms. If you get, especially a complete thyroidectomy, you're not going to have hyperthyroid symptoms any longer. If you get radioactive iodine, it depends on the dose of the radioactive iodine. If some people will get a lower dose, and they might need multiple doses of radioactive iodine before they become hypothyroid. And what's interesting, I have a veterinarian as a patient once told me that cats who are likely, they commonly get hyperthyroidism. The goal of vets, at least this is what she told me, the goal of vets is to make the cat euthyroid. In other words, normalize the thyroid hormone levels. But in the United States and most other countries, the goal is to make the person hypothyroid and not euthyroid. All right, so let's talk about some of the benefits and risks of antithyroid medication. So one benefit is that they usually do a great job of lowering the thyroid hormone levels, which again, that's why most endocrinologists are open to prescribing antithyroid medication. And then another benefit is that, again, most endocrinologists are willing to prescribe these, which might not seem like a benefit, but towards the end of this presentation, I'm going to talk about a few other types of medications which they usually are less likely to prescribe. So at least they're willing to, or most are willing to prescribe these, even though some still will pressure you into getting radioactive iodine or thyroid surgery. So risks, again, side effects are common. So with methimazole, some of the common side effects you'll see, dizziness, lightheadedness, sometimes headaches. You might get skin rashes, a decreased or depressed white blood cell count, elevated liver enzymes, which relates to this next bullet point here. So antithyroid meds definitely put stress on the liver, especially with PTU. I did bring that up before. PTU usually not recommended initially because it puts more stress on the liver and more likely to result in elevated liver enzymes when compared to methimazole or carbimazole. So you might be wondering, should you take antithyroid medication? And of course, everything is up to you. I'm just giving the information here. I will say this though, as you'll learn shortly, not everybody does well on the herbs, meaning that they don't, if the herbs such as bugleweed, which is what I took when I was dealing with Graves' disease, they don't effectively manage the hyperthyroid symptoms in everyone. So if someone is taking methimazole, if you happen to be taking antithyroid medication and you're not having side effects and your liver enzymes are fine, you might want to consider staying on the antithyroid med, just because, again, there's a chance that you switch to the herbs and they don't do the job. And keep in mind, both methimazole and bugleweed, which I'll be speaking about in a minute or so, both of those are not doing anything for the cause of the problem. So even if you took bugleweed like I did, you still want to do things to improve your overall health and try to get into remission. So, just again, if someone's taking methimazole and they want to switch to the bugleweed, I'm not opposed to helping them do this. But at the same time, if someone is taking methimazole or another type of antithyroid medication like carbimazole, and if they're doing fine, I'm not going to tell them to switch or try to talk them out of taking the antithyroid meds. All right, so let's talk about some of the natural treatment options for managing hyperthyroidism. So again, bugleweed is what I took when I was dealing with Graves' disease, and it did a great job of lowering my thyroid hormone levels. I did end up taking motherwort a few weeks later, just because the bugleweed helped, but I still was having some palpitations, and the motherwort helped with that. And lemon balm, so I did not take lemon balm, but a lot of my patients have taken lemon balm over the years. So that has mild antithyroid activity, has a calming effect. So if someone is having problems sleeping at night, they might want to look into taking lemon balm. But keep in mind, it depends on what's causing the sleep problems. While it very well might be related to elevated thyroid hormone levels, there could be other issues such as problems with adrenals, blood sugar imbalances, neurotransmitter issues. L-carnitine, so this is also something that I did not take when I was dealing with Graves' disease. L-carnitine, when taken, the research shows when taken in higher doses, so between 2,000 and 4,000 milligrams per day, that has antithyroid activity. I do find the bugleweed to be more effective, although some people will take the bugleweed and the L-carnitine. Some people will take all four of these that I have listed here. Lithium. So I'm not a huge fan of lithium. I have written an article on lithium, and I've actually written articles on all of these, so you can visit my website to learn more about these. But lithium just puts more stress on the body. Again, you could read my article, but side effects are more likely. With lithium, definitely has an antithyroid effect. So lithium, the prescription lithium commonly given for depression, but it also frequently results in hypothyroidism. When I talk about this lithium, I'm talking more about lithium orotate, which you could get over the counter. And then there's iodine. So iodine, very controversial. I am pro iodine. I like iodine, but I'm cautious when it comes to iodine because not everybody does well with iodine. So, for example, when I was dealing with Graves' disease, I took iodine, and I was one who did well with iodine. And again, I've worked with a lot of patients who have done well with iodine, but some people don't do well with iodine. Sometimes I'll make them more hyper, but sometimes you won't experience an exacerbation of symptoms, but instead it'll elevate your thyroid antibodies. So one of the problems with iodine is iodine in a formation of thyroid hormone, because we got to think about it, which to some people doesn't make sense. Iodine is important for formation of thyroid hormones. Some people might wonder, well, why would you take iodine if it helps to form thyroid hormone and you're trying to lower thyroid hormone? But iodine, when taken in higher doses, could have that opposite effect and actually lower thyroid hormone levels. But during the formation of thyroid hormone, you have oxidative stress. And if someone is low in antioxidants, and it could be due to poor diet or stress, or it could be genetic. Some people have what's called genetic polymorphisms of genes that are responsible for glutathione production. So there could be multiple reasons, but if you're low in antioxidants such as glutathione, which again, that's a master antioxidant, then you're likely to have problems with iodine. And this is why if you read a book such as Dr. David Brownstein's book, Iodine, Why You Need It, Why You Can't Live Without It, which is a great book, but Dr. Brownstein, as well as other healthcare professionals, will commonly recommend for people taking iodine to also take selenium, magnesium, vitamin C. Reason is because these are all important for glutathione production. And you could take other things you could actually take glutathione, like an acetylated or liposomal glutathione, or NAC, which is N-acetylcysteine, which converts, it's a precursor to glutathione. But again, you want to make sure, I would say test first. So before anyone takes iodine, definitely would recommend doing a urinary test for iodine, see if you're deficient, and then start with small doses. And ideally for something like this, you really do want to work with a natural healthcare professional. All right, so let's talk about the benefits and risks of supplements and herbs. So one benefit is that antithyroid herbs aren't harsh on the body like antithyroid medication. So very rarely do I see someone taking bugleweed with elevated liver enzymes. Another benefit, you don't need a prescription, so you could get this on your own. Some of the formulations do require going through a healthcare practitioner, but there are also formulations you could get on your own as well. And then a risk is that natural herbs and supplements aren't always effective in managing the symptoms. And this is why I mentioned earlier, if someone's doing fine on antithyroid medication, I'm not going to try to talk them into switching, because they might switch to bugleweed and it might not lower their thyroid hormone levels. Again, the herbs are not as potent, which is great because it doesn't put the stress on the body. But sometimes I'd say about 70% of people, it does help. But then there's like 25, 30% who the herbs aren't effective. And then I mentioned risk with lithium and iodine, so you can visit my website for more information on this. So you might be wondering, should you take a natural approach in managing a hyperthyroid condition? And again, this is up to you. If you're not taking anything, then I'd say, sure, why not? If someone sees me and they're not taking antithyroid medication, then I'm definitely in favor of them trying bugleweed. If you're taking antithyroid meds and you want to switch to bugleweed, again, if you're working with me, I'm not opposed to that. I would just go about that cautiously. But if you're taking antithyroid meds and are doing well, there's nothing wrong with staying with the antithyroid meds while addressing the cause of the problem. All right, so a few additional options to consider. So low-dose naltrexone, also known as LDN. So naltrexone, this is an FDA-approved medication, although it was approved to help with heroin and opium addicts by blocking opioid receptors. And so low doses of naltrexone can modulate the immune system. So again, it's different than like antithyroid medication or bugleweed in that it's not lowering thyroid hormone levels directly, but it's modulating the immune system. LDN, it's another benefit. It's not harsh on the body like antithyroid meds, so it typically won't elevate liver enzymes. LDN is also an option for pregnant women. So I mentioned earlier how if someone has hyperthyroidism and if they're pregnant, typically they'll be given PTU the first trimester and then switch to methimazole the second and third trimesters. But LDN also, at least the research shows it's safe for pregnant women. However, one downside, LDN doesn't do anything to address the cause of the condition, but then again, neither does methimazole or bugleweed. But one of the main reasons why it's not a first option is because it doesn't always work. So I'd say like antithyroid meds probably work like 90, 95% of the time. Bugleweed probably like 70, 75% of the time. But LDN, it's like a flip of the coin. So I can't say I've had hundreds of people over the years who have taken LDN. No, but I've had enough to see that it's hit or miss. Some people it does a great job with, other people it doesn't really have any effect. And with hyperthyroidism, when you have elevated thyroid hormone levels and elevated heart rate, you really want to get those thyroid hormone levels down as quick as possible. So to me, it's not a first option. And also keep in mind, if you have low vitamin D levels, if you're vitamin D deficient, LDN is less likely to work, or if you have a candida overgrowth as well. So a lot of times you do need to improve the health of other areas in order for LDN to be more effective. But usually I would say, antithyroid meds or bugleweed is a better first option. But if they're not working, if your antithyroid meds, let's say they're not working, or if you have side effects and the bugleweed isn't working, then LDN is definitely something to consider. And then there's cholestyramine, which is a bile acid sequestrant. So cholestyramine binds to certain components of bile, which in turn disrupts the enterohepatic circulation of bile acids. So with regards to thyroid health or hyperthyroidism, so cholestyramine binds to thyroid hormones, and then the hormones are excreted by the body. And this is why if someone is taking thyroid hormone replacements such as Armour or Synthroid, they don't want to take cholestyramine at the same time or around the same time because it'll bind to the hormone, excrete it out, and it won't be effective. But the research also shows that it binds to our endogenous hormones. And so in the research, the dosage varies from 1 to 4 grams taken 3 times per day. All right, so when should cholestyramine be used? Well, in the research, they use most of the studies are in combination with antithyroid medication. So just because in a small percentage of people, antithyroid medication won't work, but then when combined with cholestyramine, it does work. But how about if you're not doing well with antithyroid medication? There is I came across one study that showed cholestyramine was effective as a monotherapy in hyperthyroidism, meaning that it wasn't combined with antithyroid medication. And you could visit this. There's actually a blog post on cholestyramine on my website, so you can look at the research, and I have links to these studies. But so let's say you're not doing well, you have side effects or elevated liver enzymes with the antithyroid medication, and bugleweed just doesn't do the job. If that's not effective, most endocrinologists at this point will say, well, the only two choices are radioactive iodine or thyroid surgery. So you could speak with them about LDN, low dose naltrexone, which I just mentioned. Very unlikely that they'll write a prescription. I will say you could get a prescription on your own, not on your own like going to like Walgreens or a pharmacy, or you'll need a prescription. But if you go to Google or Bing and you type in low LDN doctor, for example, using those keywords, you'll find some places where you could schedule a remote consultation, at least in the United States. I'm not sure how it works if you're overseas, but in the United States, there are places you could schedule a consultation and get a prescription for LDN, even if they're not your primary care physician. So that's something to consider. Again, I don't have any affiliations with these. If you have a bad experience, please don't blame me. But cholestyramine might be more challenging to get a prescription. But I will say this: it's not a natural method, so your endocrinologist might be open to it, because it's not like you're asking them about bugleweed, which they probably won't have any idea. Most don't have a knowledge of bugleweed. Cholestyramine they'll be familiar with, but more so for if someone has like chronic diarrhea caused by bile acid malabsorption, also used in some cases of toxic molds. But cholestyramine, they might be willing to write a prescription when faced with radioactive iodine. But what I would recommend is to visit my website, print the studies out. Now, you could show them the blog post. The problem is if you just show them my blog post and they see natural endocrine solutions, they might become defensive before reading it. But if you just print if you print the studies, which again you could access through the article, through the blog post, you can show them the studies, and they might be open to writing that prescription. So at least give it a try. If not, maybe your primary care physician will be open, or maybe you have to search for a medical doctor who practices functional medicine. But either way, if you're not responding to, or if let's say you have side effects with the antithyroid medication and bugleweed not effective, then you might want to look into LDN or cholestyramine. And just as a reminder, you want to, of course, address the underlying cause of your condition. So regardless of whether you choose to take medication or supplements to manage your symptoms, the goal should be to address the underlying cause of your condition. And so you want to make the necessary lifestyle changes. You want to clean up your diet, manage stress, get sufficient sleep, find and remove your triggers. And there are typically 4 categories of triggers, which include food, stress, infections, and chemicals. And remember, a healthy gut is necessary for a healthy immune system. Most of you probably have heard of leaky gut, and most of the cells of the immune system are located in the gut. So if you want to get into remission, if you want to reverse the autoimmune component, not only do you have to find and remove the triggers, but you also want to heal the gut. Again, I talk about this on my website, so definitely visit my website if you haven't already. All right, and speaking of which, for additional information on hyperthyroidism and Graves' disease, you can visit my website at naturalendocrinesolutions.com. So one option is you can request my free 52-page guide, which is entitled The 6 Steps on How to Reverse Graves' Disease and Hashimoto's Through Natural Methods. So this would be the first option. If you haven't done this already, I definitely would recommend this. So this would be the first thing I would recommend. Another option is to watch a free webinar on hyperthyroidism and Graves' disease. So you could, again, visit my website, and you could either attend a live webinar, which I do have every now and then, or if you want to watch one right now, you could gain access to a recorded presentation. And then a third option is to read some of the articles and blog posts on my website, which I definitely encourage you to do. And option number 4 is, if you haven't already read my book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, you might want to check this out, which of course you can find on Amazon and Barnes & Noble. All right, so for those interested in working with me, I do conduct remote phone and Skype consultations with people from all over the world. I do require everyone to watch one of my free webinars on natural thyroid health. And again, you could access the webinar, a recorded presentation if you don't want to wait for a live presentation, by visiting my website. All right, and thank you so much for watching this presentation. I do appreciate you taking time to do so, and I hope you learned some great information. All right, take care, and thanks again for watching.